Hello and greetings from Phnom Penh. Thank you for the opportunity to present on one of the projects that WaterAid Australia and Cambodia have been working on over the past year. It brings together our expertise on gender, equity inclusion and health on a project called User-Friendly Wash in Healthcare Facilities. WaterAid has been working on wash in healthcare facilities for several years, and one thing we've realised is that people who use healthcare facilities, such as patients, have special wash needs that might differ from those in the community. And these include people such as those with disabilities, women who are in labour, people who have just had surgery, and also those who are very ill. And when we looked globally, we found that there weren't any tools or guidelines available that are suitable for a context such as Cambodia. So today we'd like to share the story of how we've addressed this gap, what we've done, the impact it has, and how we're going to take that forward so that everybody everywhere can use wash facilities that are accessible and usable for all in healthcare facilities.
There was limited inclusive water, sanitation and hygiene concept in the country, especially inclusive water, sanitation and hygiene in healthcare facility. Since then, WaterAid provided technical support to the Ministry of Rural Development in developing the national guideline on inclusive water, sanitation and hygiene for community. WaterAid also partnered with UNICEF to conduct assessment on accessibility and safety across school water, sanitation and hygiene facilities. Based on this expertise and experience, and this is also a great opportunity to expand our works on inclusive water, sanitation and hygiene in healthcare facility to address inclusion and gender in our water, sanitation and hygiene in healthcare facility.
We are quite excited to start working on this project user-friendly for wash in healthcare facility. It has a lot of challenges to overcome as three sectors together: wash, health and disability. So we start our work by engaging the voice of user, pregnant women, people with disability, and then we bring the tool to the expert to review, and we come up with the trial the tool and then the development of the technical design, and the tool is ready and we look forward to bring it to scale.
បើតាក់ទងបច្ចេកទេសក្នុងការបង្កលក្ខណៈងាយស្រួលមួយដែលយើងធ្វើតាក់ទងនឹងហេដ្ឋារចនាសម្ព័ន្ធហ្នឹងគឺយើងពឹងផ្អែកយើងគិតទៅលើគោលការណ៍ RECU R ហ្នឹងគឺ reach ហ្នឹងបានន័យការទៅដល់ឬក៏ការមកដល់របស់អតិថិជនអញ្ចឹងគ្រប់អតិថិជនគាត់ដើម្បីមកទទួលសេវានៅមណ្ឌលបានដើម្បីមកដល់នៅមណ្ឌលបានគាត់ត្រូវធ្វើដំណើរពីផ្ទះរបស់គាត់តាមរយៈផ្លូវអញ្ចឹងបើផ្លូវនឹងពិបាកក៏គាត់អាចមកដល់បានដែរគាត់ត្រូវមានមធ្យោបាយធ្វើដំណើរមកមានម៉ូតូមានឡានឬក៏បើគាត់ប្រើតេស្តគាត់ជិះតេស្តមកដើម្បីមកទូសេវាអញ្ចឹងយើងត្រូវធ្វើម៉េចឲ្យផ្លូវដើម្បីមកកន្លែងមណ្ឌលហ្នឹងមានភាពងាយស្រួលគោលការណ៍ទី2គឺ inter E ហ្នឹងគឺ inter មានន័យថាការចូលមកខាងក្នុងអញ្ចឹងដើម្បីចូលមកខាងក្នុងមណ្ឌលបានបើមណ្ឌលយើងនៅខាងលើអញ្ចឹងគេកសាងឲ្យមានចម្រេលឡើងទៅជាន់លើដើម្បីគាត់ចូលក្នុងមណ្ឌលបានយើងមើលទ្វាររបស់មណ្ឌលតើទ្វារចូលបន្ទប់ពីគ្រោះជំងឺហ្នឹងគាត់ចូលបានអត់ណាគាត់អាចចល័តតេស្តអីបានអត់គោលការណ៍ទី3អក្សរ C ហ្នឹងគឺមកពាក្យពេញថា circulate ការបំលាស់ទីតើពេលដែលគាត់ឡើងទៅដល់លើមណ្ឌលហើយគាត់បំលាស់ទីនៅក្នុងមណ្ឌលនឹងបានដែរទេគាត់អាចចេញពីកន្លែងទទួលអ្នកជំងឺដំបូងគាត់ទៅពីគ្រោះជំងឺនៅបន្ទប់ពីគ្រោះជំងឺឬក៏គាត់អាចចល័តទៅបន្ទប់ទឹកឬក៏កន្លែងបើកថ្នាំបានអត់គោលការណ៍ទី4គឺ U មកពីពាក្យថា use គឺការប្រើប្រាស់តើការប្រើប្រាស់មានដូចជាអីគាត់ប្រើប្រាស់តុកពីគ្រោះជំងឺនឹងបានអត់បើគាត់ជាតេស្ត
គឺធ្វើពេលពីមុនមកយើងអត់ដែលមានអាកន្ទប់ជួនពិការអីយ៉ាងនេះឥឡូវយើងមានតែចូលមកវាមណ្ឌលខ្ញុំអាចមានការរីកចម្រើនខ្លាំងដែរព្រោះមានតាំងពីអាចកសាងនៅកន្លែងសម្រាប់ឡាបបោកន្លែងលាងដៃបាន3កន្លែងហើយយើងចាក់សាបនេះមុខនឹងហើយនឹងដណ្ដៅដាក់សុករីកចម្រើនផ្លាស់ប្ដូរពីមុនថាយើងបុគ្គលិកយើងអត់សូវមានអត់ដែលលាងដៃអីទេគាត់តែលាងនឹងទឹកអត់មានលាងអាល់កុលដល់ឥឡូវWaterAidហៅទៅសិក្សាទៅយើងយល់ថាមានសារៈសំខាន់ពេលមុននឹងក្រោយប៉ះពាល់អ្នកជំងឺយើងត្រូវមានទឹកអាល់កុលលាងដៃគ្រប់កន្លែង កន្លែងទាំងកន្លែងពិនិត្យជំងឺកន្លែងកុងស៊ុលកន្លែងឱសថហើយកន្លែងបាក់សាំងកន្លែងពិនិត្យទីពោះមានទាំងអស់
មកសម្រាមកូនអាម៉ាន់ថ្ងៃថាខែកល្ងាចនេះទៅយប់នេះបាទអី
So what next for our user-friendly project?
Yes, we're going to share, adapt and use the tool in other programs, including in our Water for Women program in Myanmar to support safe births.
Yeah. How about you, Rosin?
We will continue join our advocacy work between water and hair and equity and inclusion program for the health sector.
Yeah, as always, we will join collaboration, work as a team across equity, inclusion, gender and health for everyone, everywhere.